CAR T therapy and myeloid malignancies, and I'm actually going to expand that a bit and say cellular therapies in myeloid malignancies, cellular therapies other than allogeneic stem cell transplant have a longer road to kind of go when compared to our colleagues utilizing these therapies in B-cell malignancies like lymphoma and acute lymphoblastic leukemia. And I think in part that's because it's been a little more difficult to find the right target on cell surfaces to then be able to use cellular therapies for. One target that I think holds promise and has been kind of effectively targeted is CD123. And there are a number of CD123 directed agents that are in various phases of development. And this even goes beyond cellular therapy. We're talking about antibody drug conjugates, bispecific antibodies that are being looked at. We actually have an FDA approved agent, tagraxofusp, for BPDCN, which is a CD123 targeting agent and is being looked at more broadly in AML on the whole. So one of the abstracts I had the privilege to look at, 7005, which was presented by Dr. Stein from the City of Hope, is an early phase study that actually looks at a CD123 directed NK cell engager. And with the caveat that this is an early phase study, about 23 patients looked at, and the primary endpoints being analysis of safety, what was found was this agent could be delivered at fairly high doses without dose-limiting toxicities seen. On the other hand, of the 23 patients that were seen, that were analyzed, only 3 had a response to this therapy. I think many open questions remain about what the effective dose of this agent is, how to best administer it, whether this is a therapy that can be thought of as a bridge to something like transplant versus if there's more durability with it being offered as some sort of maintenance therapy once a response is achieved. All that being said, my thoughts are that CD123 may ultimately be the right target for us to then kind of make headway when thinking about cellular therapies, whether those be CAR T, NK cell therapies, or otherwise in myeloid malignancies.